Chip, thank you so much for taking time to be with us today and talk a little bit about the service that we've had with your father.
Mm-hmm. You're welcome.
And I'm sitting here with Karen Whita, one of our nurses on staff. And Karen's worked with your family a lot.
Yes.
And so your father has had service for around 2 years?
A little bit less than 2 years, yes.
Okay. What are some things that are highlights for you about our service and working together and helping your father?
I would be specific because we've used the Oakwood office.
Right. Our Eastern Cuyahoga County office,
yeah.
Right.
And so that's the only office of HomeInstead for which. Well, there are a number of factors that overall are very, very positive. First of all, it was we received a recommendation for HomeInstead from our geriatric care manager.
That was Carol?
Carol Miller.
Carol Miller, okay.
Who's written books about
lots of books,
nursing.
right.
Yeah. And, I mean, I think one of the challenges is that without a person like a geriatric care manager, it's very difficult to know to whom to turn.
Right.
I mean, there might be a tendency to say, well, let me try to find some people on my own. So one of the first points for me is that having an organized service, such as HomeInstead provides, takes a lot of the anxiety away from, in contrast, using, let's say, trying to hire private people on one's own.
Right.
There's staffing. So somebody's going to show up, as opposed to people that I know who tried to hire people individually with good intent, and if they didn't show up,
the son gets called.
But the situation, however, without the caregiver showing up, there was not any backup. With a reliable service, that's just not a worry. I think HomeInstead has been very good to excellent, particularly the regular people that he sees. Treat him, they do their job very well in terms of nursing tasks, assisting him, but they also treat him with a lot of respect. And my dad is, in his current situation and over the last year, has not been easy. Yeah. He can periodically get emotionally volatile. He can periodically get angry. And the caregivers from HomeInstead have continued to treat him decently. In other words, better than he may have treated them.
Yeah. Now, you said he's had some serious decline in the past year.
Over the past, now, it's roughly 2 years.
Roughly 2 years.
And he had started to decline, and as with a lot of the geriatric population, what put him into more serious and persistent decline was a series of hospitalizations and surgeries. And that made him less mobile, but also seemed really to impair his mental function and his emotional control, so to speak.
Now, I know you've worked with Karen a lot, from a communication side and a client care side. How has that experience been?
My experience with Karen is very, very positive.
Well, and not just Karen, but communication with the office and
office communication with Karen is, I would say, excellent. Okay. And again, I'm trained originally as a physician who did family practice and emergency medicine, and I had my own practice. And I actually have additional training in communication and social work and intervention. So my experience with the office and with Karen has been very, very positive.
Okay.
I've gotten the information I needed. If there was a problem, it was addressed quickly and efficiently. And we've had a couple of challenging situations around my dad, particularly with other family members who were being obstructive. And Karen and the other office people handled it expeditiously and very diplomatically, which, with some of these situations, was not easy. So they deserve gold stars, platinum stars, whatever they are. We have had caregiver meetings periodically because my dad clinically has changed, which is natural. And the parameters for his care, therefore, have had to change. What worked 3 months ago really doesn't work anymore. Right. It's not relevant. So those have worked pretty well. I think they've worked very well. And they've been very useful meetings. They've been very cordial meetings. And frankly, I have almost been surprised at the willingness of the HomeInstead caregivers, number one, to show up. It's not that they don't have anything else to do. And number two, to accept the changes relatively graciously and be able to incorporate them in their care that they give to my dad.
That's very, very important.
Well, it's very important, it's just not easy.
Right.
The HomeInstead caregivers have done a very good job of working with him to the best of their ability to get him socially involved, keep him active, keep him engaged even if he's in his apartment. And again, my father's a fine man, and at the same time, over the last 2 years, he has not been easy. He has changed, his preferences have changed, and there's a certain amount of unpredictability, which is not uncommon in any age group. So I think it's, again, I'm very pleased with the care that he's given. Overall, I think the caregivers have given him excellent care, and they have treated him with respect.
Which I agree is very important.
I think it's essential.
Right.
Working with an agency that is certified, credentialed, that does reference checks, really does them, on the people that it's going to have as caregivers, is a safer and more dependable route. There is a tendency that I understand for people to want to try to hire people on their own. Maybe they think that they can get a break, but basically, HomeInstead, the cost of HomeInstead for us has been quite reasonable comparatively. I mean, it is not inexpensive. People should know that going in. Generally, this kind of care is not covered by insurance unless it's long-term care, insurance-based. So it is not inexpensive, but by and large, comparatively, HomeInstead has been pretty good. But working with an agency that is credentialed, that does reference checks on his people, basically guarantees, to the best of anybody's ability, that the person coming in this case, to take care of my father, is a responsible person and is going to treat him reasonably and is going to do the requisite, not just nursing things, but involve him to whatever extent, and not just sit on the couch or take a smoking break, which happens.
Right.
That has not happened with HomeInstead. I actually think working with an agency that is credentialed and does do background checks is a better way to do things. Otherwise, unless a person who's responsible for the care of an elder is willing to do all that work on their own, there's a lot of degree of uncertainty. And in the case of elder care, I don't think that that's acceptable. It wasn't acceptable to me. And again, HomeInstead was recommended to me by the geriatric care practitioner, who herself is very, very well known in the geriatric nursing field. She said, these people and this office are really good. She was right. And that, frankly, that's just a piece of really nice luck. I mean, the smart thing on my end was that I had our geriatric care manager meet my father before he actually started really to decline. And that was a matter, maybe that was good planning on my part, but it was also fortunate. Mm-hmm. So by the time he really needed assistive services, she knew him, he knew her, and she had made the recommendation. We had already talked about HomeInstead. Those also, it wasn't a big transition. Mm-hmm. I think at HomeInstead, this particular office, again, I can't speak for the other office. This office has done a really fine job of taking care of my dad, and which has not been an easy task.
The company was founded by a family with 6 kids, and they thought this will be a quick, easy thing. We'll just do a little spreadsheet and have everybody go out. You take Tuesday from 10 to 12, I take Thursday, blah, blah, blah. And they realized it's way more complicated than that.
Yeah, it's very.
It's,
And it's going to be, because there are, in some ways understandably, but there are a lot of regulations and there are a lot of government rules with which you have to operate.
Right.
They may not,
and I think there'll be more coming, right?
I'm sure there are going to be more coming, because we've all heard about abuses of elder care, which is regrettable, tragic. But again, this is not something that I had to worry about.
Well, thank you so much, Chip.
You're welcome.
We appreciate you taking the time.
It's my pleasure.
Thank you.
Thank you.
The dog is here.
Here's the dog. Keep talking.
Chip, you're going to learn to love me. You're going to learn to love me.
He likes you already. There you go.